a deep breath in through your nose, and that air comes through right away because all that surface area is dominated by these conchi and mucous membranes. Anything in that air that's not supposed to be there is literally going to stick to the walls of that nasal cavity, leading to a higher quality of oxygen that's actually going to move down into the lungs for gas exchange. So guys, that's what I just talked about. Put it in summary. Coani, I'm looking at the conchi. Conchi increase the surface area. Surface area increases mucous membrane. The more mucus you have, the better quality air you get pulled in. So make sure you can put that summary into effect right there. Guys, this is a good cross-section, a sagittal section here, looking at the nasal cavity. Right here was the nostrils that we were just talking about. This is also called the external nares. Guys, what was this little area right here described as we enter the nasal cavity? That's the vestibulo. What is the dominant anatomical feature right here? That'd be a good fill-in. What is the dominant feature of the vestibulo, the nasal cavity? That's the entry into it. You probably see some protruding from your grandpa's nose hanging out. The hairs. What do we call the hairs? Vibrissae. Make sure you understand that. The vibrissae will dominate that vestibulo. And then this is what I was talking about. You can see how this entrance is very narrow right here. But as we move into, this is actually the meat, or the main portion of the nasal cavity. And from this picture, it looks like it's very wide open, a lot of space there. But in reality, I'll show you this week in lab when we go back to the cadaver, these three folds of tissue are going to dominate that area. There's the superior nasal conchi. There's the middle, and then there's the inferior. And remember, I need you to understand, they increase surface area, which increases mucous membrane, increases mucus production. The overall effect of that is to lead to a higher quality of oxygen as we breathe it in through our nose. How many of you guys ever played sports? We're athletes. So I got 2, 3, 4 of you guys. I played football myself, so I understand athletics, big fan of it. I don't know if you guys have ever heard, but if you've ever had a good coach, they would have told you, when you're dogging it, when you're tired, when you're in that fourth quarter, breathe through your nose. Initially, when you're training your body to do that, it will feel like you're not getting enough oxygen. You will want to open your mouth because you can't pull more through the mouth. But if you can train yourself to breathe through the nose, you're going to be leading to the air being humidified, cleansed, and warm. So you're going to get more oxygen in the end down to your lungs. I used to have a football coach in high school that when we were training, when we got down to those last sprints, he made us breathe through our nose. If he saw us running with our mouth open, we'd have to run the sprint again. And he was trying to train our bodies to get that higher amount of oxygen. So just think about that as you go through for the functions of warming, humidifying, and cleansing the air as it comes through. As we move through the vestibulo, and we start to examine the nasal cavity from a histological standpoint, the rest of the respiratory tract, excluding the vestibulo, is going to be lined with ciliated, pseudo-stratified columnar epithelium. Let's once again come back and make sure we're comfortable with these terms. What does the Greek prefix pseudo mean? Fake, falsely advertised is kind of the way I put that. So if I'm telling you this means fake, that means when you examine that type of epithelium, upon first glance, it will appear that there's multiple layers there. But if you were to examine it a little bit closer in detail, you would see that it's not multi-layered. It's actually one layer of abnormally shaped cells. This entire pseudo-stratified columnar epithelium is going to be embedded with specific types of cells known as goblet cells. Do I have any wine connoisseurs in here? Anybody enjoy drinking wine and tasting? Yeah, absolutely. So when you go through and you're at a nice restaurant, do you ever notice how they don't bring you out a beer mug for your wine? They put it into a specific glass. What do we call those? A goblet, absolutely. Once we look at the cross-section of this tissue, you will see the resemblance of these cells to a wine-shaped goblet glass. Guys, I'm going to give you a test concept right here. You need to understand, pseudo-stratified columnar epithelium is dominated by cilia. Those are those short, hair-like extensions on the outside. And they also are dominated by goblet cells throughout the length. These goblet cells are going to be responsible for helping secrete extra mucus. That will help function to keep that respiratory tract clear of any dirt and debris that's coming into the inhaled air. As we start to move through and look at the functions of the nasal cavity, we need to take on olfaction or smelling. The olfaction function is carried out by specific sensory cells called the olfactory cells, and they're embedded in the olfactory mucosa. You can almost always find the olfactory mucosa situated on the superior portion of the nasal concha. So it's going to be from the top portion. That's where your smelling fibers and those cells that pick up aromatic odors are going to be. Guys, I normally don't get into too much pathological conditions in lecture, because you have an upper level class for that. This is so common, I felt the need to throw this in right here. You guys would commonly refer to this as a nosebleed. From now on, when you're in your fields, we want to call this epistaxis. That would be what we use the term for nosebleeds. Typically, these are going to be the result of any type of trauma to the lower nose. They're typically induced by a blunt trauma. We do have some children that have a problem with nose picking a little bit. That can also trigger release of blood and so forth. If you are ever noticing on a patient that they are having unexplained epistaxis, you don't know any reason, they're constantly having this. The cells of this area of your body are so thin that if you have high blood pressure, what we call hypertension, that's going to be one of the first signs. You're going to have these unexplained nosebleeds. Because the pressure in your blood vessels is so high, it eventually forces that blood out that thin tissue. You have these nosebleeds kicking in.
What about a child who's
We're probably I don't want to say it's this right here automatically.
Not for that. I have a 16-year-old son.
A 16-year-old.
He'll wake up sometimes in the middle of the night.
I would have to say that there could be something. Do you have a genetic history through your family of hypertension, heart disease, heart attacks? The first thing I would advise you to do is to test his blood pressure to see where it's running at. Because even just a slight above, because your blood pressure is constant at all times. If you are even running anywhere from 10 to 15 numbers up on that, because it's constant all day long, we can see that lead to some of that minor condition. So the first thing I would be telling you off the top of my head, check the blood pressure. It might be something you're looking at, even just a slight elevation of that blood pressure. Beyond that, you might be looking at any type of it could be diet-induced, it could be pharmacologically induced, there could be some other conditions. You might be looking at a condition where he's sleeping where it's very dry, and his nose is drying out in the environment. And if that nose dries, you take that mucus out from the membrane, it's much easier to cause that bleeding through as well. So you want to just kind of look at it from those angles there.
My daughter, her nose bleeds as well. Somebody told me to put some pine cream, like, up in her nostrils.
Just for the moisture.
Right.
It might be to the point where, because we're in the summertime now, you might be looking at something as simple as throwing a humidifier in the room. That might be able to clear the situation.
Somebody said something about they could freeze something in order to stop the nosebleed.
Well, if you're putting a cold, like an ice block or so forth on that, the cold temperature from that's going to shunt and force the blood down to a deeper tissue. Be much harder to bring it to the forefront to bleed then. So that would work as well if we're looking at something from that. You're probably looking at just a dry environment. I mean, he's healthy otherwise, no other issues. It's probably just a dry environment is what we're looking at. That's very common through anybody's house. You know, in my house, I got 3 floors, and I'm not kidding. We want to run that temperature at 72, keep the night outside, but it goes from, even when the thermostat's 72 on the middle floor, it goes 82, 72 in the basement, it's 62. So, I mean, you try to control it, make sure it's homeostatic everywhere, but, you can't do everything all the time. So. Guys, right here is the histological cross-section. This is a beautiful stain put together by the KU Mesa. These guys did great work here. This up top right there is what I'm really trying to highlight here. This is a perfect example of looking at pseudo-stratified columnar epithelium. We know this is a type of epithelium that lines the entire respiratory cavity besides the vestibulum. Guys, right here, what are these short hair-like extensions right there? That's going to be the cilia. Remember, the function of the cilia is going to be moving back and forth in that wave-like motion. They're constantly going to be moving any of that dirt, dust, or mucus up to the surface of the throat so you can expel it. Coming across through the bottom, there's the bottom portion of the epithelium. Can somebody remind me, what do we call that bottom portion of an epithelium, that last structure? Absolutely. Kudos to you. If I had extra credit, you would have got a point right there. I'll remember that, very good. That's the basement membrane. Here, let's see if you can take it one step further, Ms. Browner. I'm gonna put you on the spot because you're showing me you're hot right now. What do we call that connective tissue found directly deep to a basement membrane? You guys should have brought this with you. If you were my friend, if you would, I'd be getting on you right now.
So easy.
You guys remember the term lamina propria?